All right. So we're here with my patient, Twyla. This is Dr. Lawrence. And Twyla and I actually go way back because you've been a patient here for, gosh, since probably like '03.
Since you first opened.
Yeah, like '03. So it's been about 7 years. And I think initially when we saw you, it was for radiating arm pain.
Neck and arm. Yeah.
Neck and arm, yeah. That has been a problem for a while.
A long time.
Yeah. So basically what happened with Twyla is that we treated your lower back for quite some time, and we got to a certain point where we just weren't getting anywhere,
right,
chiropractically speaking. So I had actually referred her out to see somebody else for an injection, for maybe a surgical consult or something, and you ended up coming back into the office to ask my advice when you were told that they wanted to do some surgery on you. Mm-hmm. And the time that you came back, just to give you a little bit of background, we had just gotten our decompression table. So when you came in with your paperwork and basically were like, what do you think about this? I said, I don't know if that's such a great idea. And you and I decided that we would do a trial on the decompression. And that was probably a year ago?
Yes.
Maybe a little bit longer. Okay. So tell me a little bit about how that all came about, how you'd gone and they'd given you advice to have this spacer thing put in.
Well, I checked out several things. One would have just been to have surgery and have my back fused. And I was really reluctant to do that because what research I'd gone into said that people still had pain. And if you're not going to get rid of the pain,
Sure.
why would you have the surgery? And then I checked out something else that had a spacer that they wanted to put in. And I don't know. I was just reluctant about back surgery, period. And so when you got the decompression table in, I thought, well, I'll try that. I'll try anything and everything before we did surgery.
So tell us a little bit about what was the problem that you were experiencing that you were even considering having something like that done?
I couldn't walk.
Okay.
I would be fine when I sat down, but I couldn't go to the grocery store. I would have to lean over the grocery basket. At the mall, I would have to, I just went from bench to bench to bench because when I tried to walk, my back would hurt. I tried patches on it. Like you said, we had the injections and that helped for, maybe a couple weeks, and then it was back.
You were also having some leg pain in both sides.
Yeah, sciatic pain that ran all the way down the leg. And
you were pretty miserable.
Miserable.
Yes. And the bummer about that was your husband just retired. You guys could be out traveling or something.
Yes.
That kind of really puts a crimp on it. So tell us a little bit about your experience when we started doing the decompression with you.
Well, when we first got on the table, I laid there for the 15 minutes and I didn't feel anything. But almost immediately from the very first session, there was a relief in pain.
Yes.
And, I was able to extend from time to time how much longer I could walk and how much better I could get around.
Right.
To the point now where I don't have any back pain at all.
Fabulous. So we ended up doing, I think initially we talked about doing like a 10 visit, and we agreed that if you had, a certain amount of improvement in 10 visits, you would do, you would finish up the protocol, which was over a 3-month period. And really from the first visit, you were already starting to feel better.
Yes. So I felt help immediately.
Exactly. Yeah, I think the first visit, you didn't have any leg pain after that, or it was very intermittent. So
we got it to where the pain was just in my back.
Right.
And then that diminished, and I don't have that now either.
Excellent. So one of the things that we did, we went through that 3-month protocol. We did the brain-based stuff. We did some oxygen with you. We did, some of the brain things that we do with the caloric and a whole host of other things. And all those were contributory, but the spinal decompression table just is awesome.
It's the table.
The table's awesome. You're exactly right. So what happened was we went through that 3 or 4 month protocol, and you did really well with it. And then we ended up moving, and there was a bunch of stuff that went on at the office, and we were in a transitional time, and we kind of got off of our monthly, our monthly visit where we would refresh you on the table. And you came in, probably was, a month or so ago, and you were starting to get some of that back pain back because we hadn't really kept up with it like we should. So we backed you up a little bit. We did a couple visits over, a month or so, and now you're back to
being perfect.
Being perfect all over again. So the key here is your problem on MRI is stenosis. So, I'm not going to take stenosis away.
Right.
If we were to do another MRI today, you probably would have the same degree or, a very similar look to the MRI. But the difference is you feel great versus not feeling very good at all.
Ever so much better.
So really that's what we're looking for. So the point I wanted to make was once we get you to that point, we just need to stick with something that works for you.
Right.
And for you, if 2 to 3 weeks or a month, to come in and get treated is a whole lot better than taking, rolling the dice to have some surgical intervention that may or may not work. And most of the time, people are disappointed with. So anything you'd like to add for someone who may be suffering with leg pain or back pain or not able to walk like you were?
See your chiropractor. See Natalie. She's the best.
Thank you, Twyla. I appreciate it. Thanks for taking your time.
You're welcome.